like at
Okay. Hi, everyone. It's Dr. Anne-Marie Fine and Dr. Lynn Patrick. We are the founders and medical directors of Environmental Medicine Education International, where we teach a one-year postgraduate course in environmental medicine for healthcare practitioners. We are going to have some short videos on really highly topical chemicals of the day. And today we're going to start with probably our favorite bad chemical, which is BPA. BPA is it's the poster child for endocrine disruption, and it's considered one of the top obesogens. And why is this important? Surely everybody by now has figured out that all of our patients who are becoming overweight or obese or developing diabetes, it's not, you can't blame it on their eating Twinkies for breakfast, right? Or sitting on the couch. There are other environmental factors at play, and the biggest environmental factors, frankly, are endocrine disruptors like BPA. So how many people have BPA in them? According to NHANES data, it's 93% of Americans. And the health effects of BPA, it continues to grow. It's not just an environmental, it's not just an endocrine disruptor. There are immunotoxic effects of BPA and, keeping your immune system strong, especially during this time is even more critical. And yet we have certain things like BPA and phthalates and other endocrine disruptors that not only are affecting our hormone system, they're affecting our immune cells, more than one of them, like macrophages. Some other things that have come out about BPA, which are relatively unknown, is that BPA is highly associated with recurrent miscarriage rates in women. And the odds ratio for women in the third quartile for BPA, the odds ratio is 3.91 for recurrent miscarriage and 9.34 in the fourth quartile. And what's really—
so, Dr. Fine, this bears repeating.
Okay, I'm going to say it again.
Yeah, and let's just add that fourth quartile is the top 25% of the population, right?
Right.
We're talking about 25% of adults.
Right. And we all know infertility and reproductive difficulties are burgeoning in our society. And this is one of the reasons why. We're going to talk a bit about BPA, and our purpose here this morning, Dr. Patrick and I, is we really want to give you a fresh insight into this. So let me say it again. The odds ratio for BPA in the third quartile versus the first quartile is 3.91 for the third quartile, 9.34 in the fourth quartile. And of course, we are comparing to the lowest quartile, which means we're not comparing to people without BPA. We're comparing to people with just a little bit, which, is probably everyone. Okay, that's bad. But did you know BPA has been found to increase all-cause mortality by almost 50%? In addition to all these other things we're talking about, death from any cause is also increased with BPA. So let me turn it over to Dr. Patrick. Has some very, very new news from the European Union. So let's talk about that.
Anne-Marie, one more thing before we jump into the EFSA report.
Yeah.
This study, the DESIR study, DESIR from France, that looked at 9 years following urine BPA levels and looking at those with the highest BPA levels versus the lowest BPA levels. And there was a significant risk, at about double the risk for those that were in the highest, I believe it was tertile, could have been quartile, but let's just say quartile to be safe. But the other thing was BPS. Anyone with even anything above the limit of detection for urinary BPS had an even higher risk for type 2 diabetes, being diagnosed with type 2 diabetes.
That's right.
Now, keep this in your heads because we're going to be talking about BPS a little bit later, some actionable things related to BPS because we can measure BPS now. So in December, EFSA, the European Food Safety Administration, which I thought was the equivalent of the Food and Drug Administration, but I was corrected by Dr. Frederick von Saal, who we were on a call with recently, that it's really closer to the National Toxicology Program. Now, the National Toxicology Program, you probably never heard of it, right? That's here in the United States. They actually do the research that ends up being regulatory. So I'm sure you're all aware that the allowable safe levels for children now are 3.5 microgram per deciliter of blood lead and below. It used to be 5. Why did it get lowered? Because the NTP, the National Toxicology Program, put together the evidence that showed that actually there's some pretty clear evidence of learning disabilities below 1 microgram per deciliter. So as there always is in regulatory agencies, there was some compromise and they settled on 3.5 microgram per deciliter. So EFSA did all this review of every available study, literally, and these are mostly animal studies on BPA, and their findings, and this is very clear. There was a press release made by some organizations here in the United States related to this. EFSA was very clear about it. The allowable level of exposure to BPA, according to this EFSA report, is 5,000 times lower than the average exposure of adults and children here in the United States. Put another way, we're exposed to 5,000 times more than EFSA says is safe for BPA. This is just bisphenol A. Now, that was a bombshell, but in the bombshell inside of the bombshell was that the literature, the research they used to make this decision was based on the immunotoxicity of BPA and specifically its effects on the dysregulation of what are called Th17 cells, CD cells, that are known to increase risk for asthma, allergies, and autoimmunity. Now, EFSA, of course, is now going to make some regulatory suggestions to the European Union. And it appears that they are going to actually phase out bisphenols. It remains to be seen. But on the day that their report came out, several organizations, National Research Defense Council, the Breast Cancer Project, the Environmental Working Group, and a signatory that probably really carries the most weight of all of them, Linda Birnbaum, who's the recent ex-director of the National Institutes of Environmental Health Sciences, right underneath the NIH, the NIEHS, which she led for many, many years. They do human research on environmental exposures. And she has been on this for a long time. So as a result of this EFSA report, they wrote a letter to the Food and Drug Administration, to the individual who is individually responsible, personally responsible for the regulations or the safety data on BPA. And they said to him point blank, what are you going to do about this? So for us as clinicians, as healthcare providers, what are we going to do about it? What we can do, what we have the ability to do and the power to do is to educate our patients about avoiding BPA, as well as all the other bisphenols, bisphenol S and F and AF. There are a whole host of bisphenols. There's a whole family of bisphenols. And as Dr. Fine can inform us, there are new laboratories available to actually measure all of these bisphenols.
Yeah, so the bisphenol measurement, there haven't been a lot of options for measuring BPA. I believe everybody should know their BPA levels because I thought they should know it before, but now that we know that we on average have 5,000 times the safe level that has been recently determined, it really behooves all of us doctors and patients to test for BPAs and see where we are. This is the only way you're going to know if your program for avoiding BPA is working, and it allows you to see exactly where you are, compare yourself to different standards, and then there has to be an assessment, an evaluation of where is it coming from. This is why being an environmental medicine doctor is a little bit like being a detective, and that's where we come in. We find all these hidden sources that people had no idea that they were being exposed to, and that's where the metal meets the road.
Yeah, and recently in our training program and in our podcast, I reviewed an article by the scientists at the Silent Spring Institute, who are fabulous. The Silent Spring, named after Rachel Carson. So these are scientists who actually look at toxicant exposure in everyday products and in home environments, and then they publish in the scientific literature. And they actually, and I allude to this in our information in our training program, that they have figured out how to identify products with hidden bisphenols in them. And so that's crucial information to have, right? Is to teach your patients, how can you because it's not always on the label. It's supposed to be.
Never on the label. Never.
But they actually went through, I'm going to say about 120 personal care products, and they were able to find the hidden BPAs as well as the disclosed ingredients on the label. And they were able to figure out how you could find the hidden BPAs by looking for those disclosed ingredients on the label. It's brilliant of them. But we know as clinicians that there are a whole host of places that BPA exposures hide. And we can teach our patients about that, as well as helping them reduce their bisphenol exposure and increase their bisphenol elimination.
Right, and that's what we teach in our program. And so if you want more information, it's going to be at emeiglobal.com. And we also have a monthly podcast, which is amazing. So that's going to conclude our video on BPA. I hope you enjoyed it.
Okay, cool.